if we uncover the stress, and it's always a stress that's producing changes in the circuits of the brain that then in turn produce the symptoms in the body. And if you trace it back to the causative stress, like the sexual abuse in the first patient that I mentioned, you can help people cope with that. And when you do, they start to get better. Now, sometimes it takes, months of counseling or even years of counseling to get the outcome that we want for patients. But even those patients, they know they're on the right track. They can see that they're making progress, and it's a tremendous source of hope for them.
Yeah, that's very interesting. Are these always psychological problems that cause these physical disturbances, or sometimes there's an underlying physiological cause?
You can have both at the same time. It is possible to have a biomedical problem that is made substantially worse by a psychosocial stress of one sort or another. But the majority of my patients, there was a stress involved. And this doesn't mean that my patients are neurotic or that they were weak in some way or they couldn't handle their stress. I would say my patients were, on the average, psychologically stronger than the average person. They were just coping with very high levels of stress. I make the analogy sometimes that they are a bit like Olympic weightlifters who've been asked to carry 50 pounds more than the world record for their weight class. So, any weightlifter, no matter how good you are, if you're asked to carry that much of a load, your body's going to break down. You're going to feel weak. You're going to feel like you can't handle what's going on. And my patients are very much like that. And when we show them how to put the stress down, then they realize how strong they were all along. And their physical symptoms, of course, get much better.
So what does it look like now? Are there established protocols that you can readily or consistently diagnose that this is this kind of psychophysiological problem?
Yes.
How far have you been able to advance?
Yeah, very much so. One good idea for your listeners is that on the nonprofit website, which is endchronicpain.org, we have a self-assessment quiz. It's only 12 items. It takes less than 3 minutes to fill it out. And it's set up in a way that the more questions to which you answer yes, the more likely it is that your condition, whatever it is linked to a psychophysiologic process or a mind-body process. But the process that I use in my office has a series of steps to it. The first is just to get the very first is to make sure that there's no organ disease or structural damage. And assuming we've ruled that out, then we're looking for sources of stress in the patient's life. It could be anything bad that's going on in your life at the moment, especially if there's a chronological link between when and where the stresses are happening and when and where your symptoms are flaring up. The next major area I look at is adverse childhood experiences, or ACEs they're called, which is pretty much anything that happened to you that you wouldn't want to have happen to a child of your own. And the more severe that was, the more long-lasting it was, the more likely it's having a long-term impact. And no, we can't go back and change what you experienced as a kid, but we absolutely can help you with the long-term impact.